I'm Dr. Shaju George, Specialist Psychiatrist, International Modern Hospital, Dubai. Today we will be discussing on panic disorder. Panic disorder is probably one of the most common anxiety spectrum disorder which we see in UAE. Anxiety spectrum disorders, roughly 20% of the total population, they do suffer from anxiety disorders. And almost 3% of the total population, they do have panic disorder. Let us differentiate between panic attack and panic disorder. Panic attack generally presents with hyperventilation, palpitation, fear of choking and impending doom, at times presenting with nausea, vomiting, vertigo. These are the common symptoms of panic attack. And if we have 2 or more panic attack in a month, we can call it as panic disorder. Both panic attack and panic disorder are common in UAE. In any case of behavioral disorders, when we talk in terms of causes, we will say that the causes are bio, psycho, social. Bio means genetic, hereditary, which can come through the genes. Psycho means psychological issues. And social means environmental stressors. Likewise, in panic disorder also, gene plays a very important role. Environmental factors like stressors plays very important role. Other psychological conditions like depression, anxiety disorders, all those conditions can also present or lead to panic attack or panic disorder. Other area which we can present with or which can precipitate panic disorder or panic attack is substance use disorders, alcohol and other substances. Panic disorder or panic attack can be managed behaviorally and non-behaviorally, or in other words, pharmacological and non-pharmacological methods. Non-pharmacological or behavioral methods of managing panic disorder are: 1. Practice yoga or relaxation techniques. Second, we will use certain plastic bag technique for hyperventilation. What we generally use is we will use a plastic bag to place it over the nose, and we will ask the client to breathe in and breathe out from the plastic bag, so that he will breathe in more of the air which is contain more of carbon dioxide, so that the hyperventilation part will be addressed and he will start feeling better and okay. Along with the relaxation and the above said technique, the other behavioral technique which we practice is CBT, cognitive behavioral therapy. A person who is having panic disorder, panic attack will fear that he is going to die. He is going to get heart attack. So CBT, what we address is basically we will give logical explanation for his symptoms, and he will be ready to accept and understand the fact that he is not going to die out of panic attack or panic disorder, and then his anxiety level is going to become less and he will be able to deal with the situation. Regarding pharmacological methods of managing panic attack or panic disorder, there are a lot of medications, and the main group are basically: one is SSRI or antidepressants in general or anxiolytics in general, and the other is benzodiazepine. That you need to follow the doctor's instruction, and you need to get prescription for the same, and you need to follow these instructions properly. Any case of panic attack or panic disorder, in general we will have to treat for a minimum period of 3 to 6 months. Then it depends. As long as your doctor advises you to continue the medication, you should continue with. Of course, panic attack and panic disorder can recur, but if you take proper treatment in the first episode, the chances for recurrence are less. Thank you.